Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the celiac trunk. We have questions and answers. So what is celiac trunk? The celiac trunk is an artery. It is a very short artery but very big distribution which arises from the anterior aspect or ventral aspect of the abdominal aorta at the level of the upper border of the lumbar vertebra 1, immediately inferior to the aortic hiatus of the diaphragm. Okay, this is the aortic hiatus of the diaphragm. So its level is T12. So just below that we have the celiac trunk. Celiac trunk is only few millimeter in length. It divides very quickly and distribute many structures. And supply structures derived from the abdominal foregut that include the part of the abdominal part of the esophagus, the stomach, duodenum, first part, and second part up to the opening of the hepatopancreatic duct. Celiac, spelling C-O-E or also C-E-L-I-A-C in the United States. Okay, what is celiac plexus, also called solar plexus? This is an accumulation of prevertebral nerve fibers around the celiac plexus. We'll add one N here. This is an accumulation of prevertebral nerve fibers. They are derived from the Splenic nerve, mostly sympathetic, with only a few parasympathetic contribution, and that forms a plexus around the celiac trunk. We call it solar plexus. Also, we have the lymph node around the celiac trunk. There is a part of the pre-aortic lymph nodes. So in the dissection hall, you will get accumulation of prevertebral nerve fibers as well as lymphatics around the celiac trunk. So this is the celiac trunk. It has three branches: left gastric artery, the splenic artery, and the common hepatic artery. Common hepatic artery again has multiple branches like that of the gastroduodenal artery here. Okay, then hepatic artery proper has right gastric artery and the left hepatic artery. With the right hepatic artery and the left hepatic artery as the branches of that. And gastroduodenal artery has again multiple branches like the pancreatic duodenal artery, the right gastroepiphytic artery, and splenic artery, the largest member of the celiac trunk, that has branches, short gastric arteries, and the left gastroepiphytic artery or left gastroomental arteries. We have the left gastric artery. It has some cardiac branches and it provides multiple branches around the lesser curvature of the stomach. So that is our celiac trunk location on the anterior aspect of the abdominal aorta at the level of the upper border of the lumbar 1, and it has multiple branches, the three branches. One is the left gastric artery, another one is splenic artery, another one is the common hepatic artery. The smallest one is the left gastric artery, the largest one is the splenic artery. Okay, so what are the branches of the celiac trunk? We've already discussed left gastric artery, common hepatic artery, splenic artery. So this is the splenic artery here, and we'll get this is the common hepatic artery, and this is the left gastric artery. Okay, we got the left gastric artery, splenic artery, common hepatic artery. This is the celiac trunk. This is left gastric artery, and this is right gastric artery that comes out of the, usually it comes out of the hepatic artery. proper, but it may also come in certain situations from the common hepatic artery. What is the course of the splenic artery? It has a tortuous course posterior to the omental bursa, anterior to the left kidney and also left suprarenal gland, along the superior border of the pancreas to the hilum of the spleen. What is the largest branch of celiac trunk? Again, splenic artery. What is the smallest branch of celiac trunk? The left gastric artery. Okay. What are the branches of splenic artery? Pancreatic branches, numerous pancreatic branches, short gastric arteries, around 5 to 7, left gastroepiploic artery near the hilum. Okay. Which arteries run in the gastrosplenic ligament and supplies the fundus of the stomach? These are the short gastric arteries. They are number 5 to 7. Which artery arises from the terminal part of the splenic artery, runs downward in the greater omentum along the greater curvature of the stomach? There is the left gastroepiploic artery. Which artery enters the linorenal ligament and reaches the hilum of the spleen? Answer should be splenic artery. Okay, again we got the splenic artery here. This is the left gastromental artery, also called gastroepiploic artery, and this is the right gastroomental artery, also called right gastroepiploic artery. This is a branch of the gastroduodenal artery. Okay, and this is the left gastric artery. This is the common hepatic artery. And we got the gastroduodenal arteries here, gastroduodenal artery. After that, the common hepatic artery continued as the hepatic artery proper. The common hepatic artery may give rise to the origin of right gastric artery, but right gastric artery in most cases or many cases arises from the hepatic artery proper. So origin of right gastric artery is little bit inconstant. Again, we have got celiac trunk, the left gastric artery. Okay, this is the gastroduodenal artery. Here we are looking at the right gastric artery coming out of the hepatic artery proper. But hepatic artery proper is the continuation of the common hepatic artery after branching of the gastroduodenal artery. So distal to the gastroduodenal artery, it is the hepatic artery proper. What is the course of left gastric artery? It runs upwards to the cardiac end of the stomach and then turn forward and downward along the lesser curvature of the stomach. What are the branches of left gastric artery? Esophageal branches at the cardiac end of the stomach, branches along the lesser curvature of the stomach, many branches. What are the branches of common hepatic artery? Gastroduodenal artery and hepatic artery proper. What is hepatic artery proper? The common hepatic artery continues as hepatic artery proper distal to the gastroduodenal artery. Which arteries passes along the lesser omentum? You can say pass, not passes. Which arteries pass along the lesser omentum? These are the left gastric artery, common hepatic artery and right gastric artery. Which arteries pass along the greater curvature of the stomach and are the content of greater omentum? Okay, these are the right gastroepiploic artery and left gastroepiploic artery. What are the branches of gastroduodenal artery? Right gastroepiploic artery, superior pancreaticoduodenal artery, usually anterior superior pancreaticoduodenal artery, posterior superior pancreaticoduodenal artery. Okay. What are the branches of hepatic artery proper? Left hepatic artery, right hepatic artery. Right gastric artery may arise from the common hepatic artery. Cystic artery, that is the artery to the gallbladder, arises from which artery? From the right hepatic artery. Usually, again there is some variation. Surgeon has sometimes hard time because there are some anomalies, but usually cystic artery is a branch of the right hepatic artery. Inferior pancreatico-duodenal arteries, again it may be two, anterior posterior, are branches of which artery? Superior mesenteric artery. Superior mesenteric artery is the artery of which gut? Midgut. Celiac trunk is an artery of which gut? Foregut. Inferior mesenteric artery is a branch of which gut? That is the hindgut. So we have three branches: celiac trunk, superior mesenteric artery, inferior mesenteric artery. So celiac trunk for the foregut derivatives, superior mesenteric artery for the midgut derivative, inferior mesenteric artery for the hindgut derivative structures they supply. What is the clinical significance of anastomosis between the superior and inferior pancreatico-duodenal arteries? This acts as a bypass channel if there is any obstruction in the celiac trunk. There may be thrombosis in celiac trunk, so then this route will work as a bypass channel to supply the stomach and the duodenum, and also part of the lower part of the esophagus, the abdominal part. So we have some anastomosis that is very important. Right and left gastric arteries along the lesser curvature of the stomach. Left gastric artery is a branch of celiac trunk. Right gastric artery may be a branch of hepatic artery proper, or may be a branch of common hepatic artery. And site of anastomosis, lesser curvature of the stomach. Left and right gastroepiploic artery, also called gastromental arteries. Left gastroepiploic artery is a branch of splenic artery. Right gastroepiploic artery is a branch of the gastroduodenal artery. Gastroduodenal artery is a branch of the common hepatic artery. Okay, so these two arteries, gastroepiploic arteries, anastomose at the greater curvature of the stomach, along the greater curvature of the stomach. Superior and inferior pancreatico-duodenal artery. Superior pancreatico-duodenal artery may be anterior, posterior, it may be split it into two. These are the branches of the gastroduodenal artery. That is a branch of the common hepatic artery. There is a branch of celiac trunk. Inferior pancreatico-duodenal artery is a branch of the superior mesenteric artery. Where these anastomosis happen? Head of the pancreas and along the second part of the duodenum. Okay, and that's all about the anatomy of the celiac trunk. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.